But just to reassure you, it'll only be myself and Mani who'll be in the recording tonight, so not to worry there. We will be using Menti tonight, which if you have attended one of the monthly lecture series talks before, you'll be very familiar with. But if you're not, it's really easy to use. It's essentially an interactive feedback tool, and it makes that talk a little bit more interactive. You can answer kind of questions in real time, and we can get to know a bit more about you and who's turned up to the talk this evening. So we will share the code to that when we get started. We'll also have a Q&A section at the end of the talk. So if you could input any questions you've got into the Q&A function on Zoom, so there should be the option to see that at the bottom of your screen. Please don't put questions in the chat because they will get lost. It's a lot more easy for us to find them if they're just in the one place in the Q&A. But if you are having any problems, tech speaking, if you're having any issues there, or if you are unsure of any of the terminology during the talk, if you could put that in the chat, that would be great, because then we can get back to you as soon as possible. And as said, if you are a bit lost during the talk at any point, or if you're not too sure what is being talked about, or if you don't really understand a word, please do let us know, because we don't want you sat there not really sure what's going on, and that way I can stop Mani and then we can get a bit of clarification for you. So don't worry about sitting there thinking you're a bit lost, because we can get some answers for you. Okay, I think that is everything with regards to housekeeping. So I will introduce our speaker for this evening. So Dr. Mani Jayamurthy graduated from BSMS in 2017, after which he worked his foundation years in Brighton, followed by Eastbourne and Hastings. Since then, he has spent a year as a junior clinical fellow in paediatrics in Bristol, rotating through paediatric specialities. He is currently a clinical teaching fellow in Bristol. He teaches undergraduate medical students from years 1 to 5. He also works with and leads on university and hospital widening participation schemes. So thank you so much, Mani, for joining us this evening, and I will now hand over to you.
Thank you, Alice, for that lovely introduction. Hello, everyone. It's an absolute pleasure to be here to chat to you about what comes next. So I'll just share my screen. And off we go. So what comes next? Life after finishing medical school. I'm Mani Jayamurthy, and I'll talk a bit more about myself in a second. The reason I wanted to talk to you guys about this is that when you're applying for medical school or thinking of applying for medical school, it's quite nice to know what comes after you finish. It's a long course, but after that, you have a whole life that is based around medicine a lot of the time. And I just want to show you that there's a huge diversity of life and jobs that you can have that is often linked to medicine. And I hope this will help some people decide if they do or don't want to do medicine. I think this one, I think Alice has already mentioned a few things about this already, but this is me. I started medical school in 2012. I graduated in 2017, and I was at Brighton and Sussex Medical School, or BSMS, as we fondly call it. And then I did my foundation years, which are the first 2 years of finishing medical school, and I will come back to that in a moment. Also down on the South Coast, and I've got pictures there of the South Coast, and because it's a lovely place to be. So I did my foundation years, F1 and F2, down on the South Coast in Eastbourne and Hastings. I then moved to Bristol to do a junior clinical fellow year, and I'll talk about that a bit more later, in paediatrics, because I thought that, I quite liked it and I wanted to find out more about it, paediatrics being the specialty where you look after children. And, it really sold it to me. I thought, absolutely, this is what I want to do. But I also wanted to be a teacher. I wanted to help teach medical students and doctors. And so I did a year, I'm doing a year, I should say, as a clinical teaching fellow, where I spend my time teaching. And then at the end of this year, which it sadly must end in August, I am starting as a paediatric trainee in London from September. So that's a bit more about me. But before we go on, I want to know a bit more about you guys. So I'm just going to now share. There we go. Let's find out a bit more about you. So I'm sharing the Menti screen, so hopefully you can see this. And if you just type in the code at the top when you go to menti.com, and just let me know, what is your nearest town or city?
Mani,
Yeah.
we've had a question in the Q&A, which is, what is a junior clinical fellow? I wonder if you might be able to explain that one.
I will come back to that, but it is a person who's finished as a doctor, finished their foundation years, which is the first 2 years after you finish medical school, and then is working not in a specific training program, but just generally as a doctor. So you're a junior because you're still relatively new in medicine, and clinical fellow as in clinical because you're on the wards and things, and fellow as in you're not sort of a trainee of some sort. But we're going to come back to that as well because there's a couple more things later on, but we'll talk about that. Lovely. So on the Menti, gosh, we've got a good number of things going on here. We've got London being the biggest, and you'd expect that. There's lots of people living in London, but we've also got lots of people from Brighton. Welcome. Hopefully you saw the photos up there of Brighton looking lovely in the sun. Belfast, lovely. We've got people all over the place: Oxford, Buckinghamshire, Hollywood. We've got Haywood Heath, Stoke-on-Trent, Newry, Worthing, Ballymena. Oh, lovely. We've got people coming in from everywhere, which is fantastic to see. And welcome to you all. And someone from Bristol as well, or maybe some people, which is great, and great to have you. Someone from India, people from everywhere. And hopefully this is, this talk is very much about what happens in the UK. So if you're joining us from abroad, this will hopefully give you a bit of an insight about how training and everything works in the UK after you finish medical school. But great to see all of you here, and fantastic to see so many unique and wonderful places on here. So what I'm going to do now is go to the next slide on Mentimeter, which should be, is that no, we've done that one. What are you doing in the day at the moment? So what are you doing in the day? Are you at school, university, between school and university, work perhaps, other sort of, could be anything. Fantastic. We've got a good range of lots of people at school, and great. And this is the thing. I when I was at school, I wasn't. I really wanted to be a doctor. I really wanted to explore this world of medicine. But did I know about the huge variety? Did I know about all of the things I'm going to talk about today? I don't think I did, and I don't know if it would have helped me. I don't think it would have changed my mind, but it would have definitely opened it out to me before I started, and made me go, "Whoa, there's so much that I can do." Fantastic. So, and we've got and some people from university, between school and university, work, great. And it's great to have all of you, and great that, we have so many different types of people joining us, which is fantastic. And hopefully this helps you all. Right. And then I've got if it goes, yes. Which of these, so this is a more technical one. Which of these is not a type of doctor? We've got occupational health doctor, diving medicine doctor, public health doctor, radiologist, geneticist. All of these are types of doctors. A bit of initially looked like it was a bit more of an even spread, but now it's sort of everyone going, all are types of doctors. And a few people saying diving medicine, a few for public health, radiologist and geneticists. I think that's all. So the answer is that all of these can be types of doctors, and absolutely there are sometimes you can be some of these sort of specialties without having to do medicine, but most of the time you do sort of medicine and then go on to do it, which is fantastic. So occupational health doctors, they work to help people after they've had injuries or anything to get back into work. Diving medicine doctor, which is one of my friends is one of those at the moment, where they look after people with diving things. Public health, that's really in the news at the moment. If you think about with the whole pandemic situation, and public health is right at the center of that. Radiologists look at images, we'll come back to that. Geneticists looking at genetics as your whole job, which is fascinating. And then, of course, all of them are types of doctors. Great, I think that is my whole Mentimeter. So I've got a good range of responses. Thanks, guys. So back to my PowerPoint. So we've talked a bit about you. Let's think about medical careers overview. And I think this might be something that you've come across a bit in the past. medical school is often 5 to 6 years. And, sometimes you can go straight through medical school in 5 years, which is what I did. But often people do take a year out and do another degree. It's called intercalation. And you do another degree that could be, depending on where you are, could be literally in anything. And a lot of people do sort of something to do with medicine, like biochemistry, or might do anatomy. But you can also do things like mental health or global health, or a whole range of things. And so medical school might take 5 or 6 years. So what happens when you finish medical school? Well, you need to start training as a doctor. And from the end of medical school, you are being paid. So the key thing to this is that all these steps, you're being paid during the whole time. You're training, but you're also working. So as a foundation doctor, you are just getting your bearings, you're getting on your feet as a doctor. And so it's 2 years of training where you do usually 6 different jobs, rotating through lots of different specialties, trying to get a good understanding of how things work and what you might be interested in, what you might want to go into. So you're trying to learn that during your foundation program, and that's 2 years, and that's what everyone has to do. After foundation years, there are some specialties. So that's a specific type of doctor. So when you think about doctors, every doctor usually has a specialism. Like you might be a surgeon, or you might be a medical doctor, or you might be an anaesthetist, which, if some of you were at Dr. Paul Young's talk last month. If not, it's on YouTube. It's great. And he's an anaesthetist, so a doctor who helps put people to sleep for operations. And these are all different types of doctors. And often to start training as that, you need to do this thing called core training, which is 2 or 3 years. And then once you finish core training, so if you want to be a surgeon, you start core training where you do different surgical things, trying to figure out what sort of surgery you want to do. Then you do higher specialty training, and you decide exactly what surgeon you want to be. Do you want to work on do you want to be a surgeon of the ear, nose, and throat? Do you want to be a surgeon of the heart? Do you want to be a surgeon of the skin? That sort of stuff. You decide at this point what you want to do, and this can be 3 years, 5 years, depending on what it is, and then you'll be a consultant. Now there are other specialties which you do your medical school 5 to 6 years, you do your foundation program 2 years, and then you just go straight into it. So what I want to do, pediatrics, which is working with kids and babies all the way through to teenagers. You go straight into it, and from the very outset, after you finish your foundation program, you can be training as a pediatrician. And it takes pediatrics takes 8 years, but there are other things that take a shorter amount of time. And then you would be a consultant, which is sort of the highest end, the top, or what you finish as, really. Of course, this is not, you might have said to me, oh, I haven't heard you talk about general practice. So for those of you who are joining us maybe from outside of the UK, a GP or general practitioner is what you might call a family doctor. And about half of all doctors are family doctors in the UK, or GPs. So if you want to be a GP, it's you finish medical school, you finish foundation program, you do 3 years of GP training, and then you're a GP. But here's the thing, during that whole time, you can, after you finish your foundation years onwards, you can step off this pathway at any time and do a whole range of jobs. And we'll come on to that. And that's what I'm doing now. And I think that's why I wanted to talk to you about it, because at the moment I am a clinical teaching fellow. So I am clinical, being ward-based, teaching, a fellow being a doctor who isn't in the training program, so stepped out of it to do something else. I just went on the NHS jobs website, which is how us doctors often find jobs, and I just looked through doctoring jobs, and here are some of the stuff that's come up in the last couple of days. And so you can see there's a huge wealth of things you can do, which isn't on the training pathway. You're not training to do it. You're just stepping off and you're doing something else for a little while. And I've decided after my foundation program to take this time. I'm now doing, I did my first year as a sort of junior clinical fellow, because I wasn't super senior. So I'm a junior fellow. And I was just working in pediatrics and figuring out if I loved it. and then doing teaching this year. So that's how that sort of works. We will circle back to that again. One of the things I want to talk about is the fact that the current training program, the core training and the specialty training, has, it's already got a huge amount of variety. Oh my gosh, look at this. So anesthetics is as I said, doctors who help put people to sleep for surgery, and also can deal with pain and things. Core psychiatry, if you want to be a psychiatrist who looks after mental health, you sort of apply to be a core trainee in psychiatry then. If you want to do internal medicine, I know it's weird that you have medicine as a degree, but then there's also medicine as a specialty. So medicine as a specialty are the people who go on to become cardiologists or gastroenterologists looking after the gut, or dermatologists who look after the skin. So but you start off by doing internal medicine, which is like a amalgamation of everything. Ophthalmology, which is eye stuff. Pediatrics, as I said, looking after kids. Public health. So you sort of, these are a whole range of things that you can apply for core training or specialty training. But as I said, with those core training specialties, the ones where you start off in core training, you then go on to do much more specialist things. And whoa, look at this. And I think there are like 70 different types of higher specialty training you can do, which is insane, isn't it? So if you become a psychiatrist, so you do 2 to 3 years of core training, or 3 years of core training in psychiatry, then you can become a general psychiatrist or a forensic psychiatrist who work in prisons and high secure units and things. You can become a old age psychiatrist who looks after the mental health of the elderly. You can do child and adolescent, so you look after the mental health of kids. So you become a very specialized type of doctor. But there's such a wealth of things that you can do after you sort of do your core training in specific things. And that's what I wanted to highlight to you, in that you can become so many different types of doctors. As a pediatric trainee, you can sort of become a general pediatrician, look after anything, but you can also go on to do specific things. You can look after kids' hearts, kids' brains, kids' kidneys, kids' mental health. You can do so many different things after you do pediatrics. So, one of the things I really didn't know was just how many things you could be as a doctor, but still a doctor. That's fantastic. But as I said, at the moment, I've stepped off of that training pathway. I'm going to re-enter it in a few months' time. But I've stepped off of it. And that's because there's just a lot more flexibility. Instead of working for sort of like a big program that moves me around different places, I'm working for just one hospital trust. And you can either work clinically, as in on the ward, doing sort of what you'd imagine as doctory work, or there might be jobs where you do a bit of doctory work and a bit of teaching or research, or maybe projects, specific projects that you might be working on. So it's greater flexibility. So I decided that the main thing I needed to do was I wanted to move to Bristol, and I was able to do that. And also I wanted to explore pediatrics without committing to 8 years of training in it. And I was really able to do that by becoming a clinical fellow, a junior clinical fellow in pediatrics. I got to move to Bristol, and I've got up there a plaque that's outside the Bristol Children's Hospital. There's this little statue outside of it, which is like little hoops, and someone's popped a plaque that says dedicated to Children's Hospital from the 1998 Quidditch World Cup, which I think is a fantastic little sign. But I'm loving living in Bristol. And I got to do that and explore pediatrics, all by doing a job for a year as a fellow, and figuring out if it's what I want to do. And then, as I said, I wanted to teach medical students. I'm enjoying doing this talk to you guys, so you can learn a bit more about what medical careers mean. And because because I enjoy doing that, I wanted to do more teaching and learn more about being a teacher in medicine. And that's why I'm doing a year as a clinical teaching fellow. So spending time just teaching medical students. And that's been absolutely fantastic. I really enjoyed doing that. And that's the real advantage of being able to step off of that training pathway, and instead of just being a doctor all the time, I'm doing different things and getting a variety of experience. And then I can go back onto the training program and learn more about the specific thing I want to do. Of course, lots of my friends who stepped off the training program at the same time I did have decided they wanted to work abroad, and you absolutely can. And so many of the people I know go and work abroad. I've got two photos here. One is of New Zealand, one is of Australia. Hopefully you know which is which. But I've got quite a few friends in New Zealand and Australia at the moment. And that's quite easy to do at the moment in terms of, you finish your foundation programs and then you go, well, I just want to get more of an experience. Instead of an experience of, a different specialty or a different city, how about a different country? And that's what you can do here. It's a bit more difficult to go to other countries like Canada and America because you have to sit more exams, which you don't have to do for Australia or New Zealand at the moment. So that's why you often see people going to Australia and New Zealand after they finish their foundation program. Of course, you can also do humanitarian work. And it's something that I'd like to do. It's just not the right time for me to do that, but it's something that I do hope to do as well in the future. So how do you do humanitarian work? Well, it's usually through a charity, and you could go anywhere, and it all depends on what sort of charity you want to help out at. I say recent examples, as in this is what my my friends have been doing recently, or people I know, my colleagues. Some have gone to the camps in Lesbos in Greece to help out there and spend some time volunteering, sort of as a doctor, spending time looking after sort of the general health of people, running clinics. And I don't know if you've heard of Doctors of the World or Médecins Sans Frontières, but I have, I've met quite a few doctors who've worked for MSF over the time, who have been, deployed to different places in the world to do some vital work in, areas of conflict and places that really needed some medical input. So this is something you can do as well when you step off the training program to do for, it could be a few months, few years, or you can build it into your life as a GP, and we'll talk about that as well. And of course, you could work outside of medicine. So a lot of people incorporate working, perhaps I've got a picture of Downing Street there because you can work for the government in a number of capacities. You can do you can join certain committees or whatever as part of your job when you're not doing sort of 100% on the ward. The turn ideas into reality photo is meant to represent working for other medical companies. So I know some people who work for medical startups and do some really interesting research and cool things with companies that are not the NHS but are doing other things. So you're still working perhaps in the doctoring capacity, just in a different type of role. The drugs there are to represent pharmaceuticals. So a lot of people do go into the pharmaceutical industry to help either develop drugs or maybe run trials or so on. So, there's lots of variety there. Some people do medical legal work. So, that sort of line between medicine and law, you can sort of be part of that as well. And the final picture is there to represent the fact that, actually, while I love medicine, and lots of people I know do love medicine, and we want to continue being doctors or working in a doctoring capacity, it's still an incredibly professional degree, and it shows that you can work hard and that you've got a lot of skills, and you can apply for things that aren't medicine, do business or finance or whatever, which that's always open to you. But hopefully, if you do medicine, you're hoping to work as a doctor or work in some sort of capacity where you get to use your medical knowledge and skill. So let's talk a little bit more about careers in medicine. As a doctor, you can also have lots of different things you're doing while also doing on the training pathway. It's just maybe you're doing 80% of work on the ward, 20% of something else, or 60% of work on the ward, and 40% something else. There are lots of opportunities there. So there are specific training programs to allow you to be an academic as in, someone who does research. And of course, lots of us have to do further study as well. And, you can get other degrees and things. So as an academic, what can you do? Well, you can do all sorts of research. So what I've got here, because, this talk is being run by BSMS, I've got two different types of research currently occurring at BSMS. You've got clinical research, so that's research on the wards or, in hospitals. We've got one that's about like high flow in asthma and on kids. So, it's this very specific, very sort of clinically relevant. You're doing something on the ward to directly impact that. But you can also, and there are some. I've got here a citation for a paper that's recently been done out of BSMS of lab-based research. So you're working on sort of maybe cells, or you're in the lab at least, and you're trying to do that sort of early research, which then goes on to become more things. But as a doctor, you can definitely be involved in this. You can, you don't have to just do sort of the doctoring work on the ward. You can be part of these sort of research things. And of course, you can also always do more studying and find out different things. So at the moment, I am completing a further degree in medical education, so I can be a better teacher, essentially, a better teacher of medical education. I'm also doing some medical education sort of research. So that's available to us as doctors to do. I'll talk really quickly on this because I don't, it's not something I've been involved in too much. It's management leadership, which is that, actually as doctors, people go higher and higher up inside the structure of hospitals. So becoming medical directors or CEOs of hospital trusts. There are also roles outside hospitals. And we talked about committees and working, working for the government, but you might be part of commissioning, which is deciding what resources certain areas need, and so on. So there's that sort of work that you can be involved with as well. And actually, to some extent, once you're a consultant, you are expected to be involved in some of this work, and you have to do it. And you have to decide which bits you want to do. And of course, teaching and medical education, which is what I want to do. And hopefully, when I'm going through my career, and hopefully once I'm a consultant, this is what I want to have as a big aspect of my career, which is teaching of medical students and also doctors. So you can be involved with teaching medical students on the ward. That's why I've got a ward there. So this is as a doctor, you can be involved with sort of on the ward teaching, maybe leading medical education in an area, or you could even be involved at university level. So you could be say take BSMS for example. BSMS needs people to write the curriculum for medicine, and so you could be involved in that. So there's lots of things that you can do within teaching and medical education. And finally, I want to talk to you quickly about the portfolio career. And I really am mentioning this because I think the winds of medicine, what medicine is at the moment, what it will be, I think are changing. And I think perhaps by the time if you want to apply for medical school, have applied for medical school and get through, things might be different. But this is how GPs, there are some GPs who work like this. And I wonder if more of us will be working like this by the time you finish. But a portfolio career is exactly what it sounds. You have a portfolio of different things. You're not just working 100% as a sort of clinical doctor. But so this GP, for instance, could be working as a GP on Monday, or on Tuesday could be teaching at the medical school, maybe showing how to do different things or how to talk to patients, that sort of stuff. On Wednesday, the GP might work as a GP again. On Thursday, the GP might be leading a team or working in the clinical commissioning group, which is deciding, how funding is allocated for different things within the local area. You don't need to know too much about that. The fact is that, you might be doing some sort of leadership-y things. And Friday might be a day off, 4-day week, lovely. But this is the realities of how your career can be nowadays, especially as a portfolio GP. And I wonder if things will have changed and it'll be like that for people outside of general practice and maybe in the hospital a bit more as well. But I want to show you this because I think it really highlights that incredible diversity of life as a doctor. So in summary, it's quite a quick talk, but I think more of it is the Q&A. I think should help us chat about these things. But it's that medicine isn't just one career. It's a career within which there are other jobs, other careers, and so much diversity of what you can do. You're not just deciding to be on a ward for the rest of your life. You are choosing a career within which you have a whole range of things you could do. You could always chop and change as well, and that's getting easier to some extent as time goes on as well. But you're not just choosing one thing, you're choosing a whole set of jobs. And of course, even if you don't, if you start training pediatrics and you're like, I don't think it's for me, then you can step off, do something else, explore a bit more, and then come back and do a whole different thing. And that is possible within the setup of medicine at the moment. So that's what I really want to get across to you guys, is that, when you're thinking of medicine, it's not just being a doctor on a ward. It is so much more than that. You can be so many different types of doctor or healthcare professional. So I think I'll hand over back to Alice to open the Q&A.
Wonderful. Thanks, Mani. That was fantastic. Really informative talk. And I know I definitely